Hi, my name's Stephanie from Fitness Quest 10, and today I'm going to show you a few exercises that can really make a difference for low back tightness or pain, discomfort after you've been driving for a long time, or maybe on an airplane, or maybe you're just kind of stiff when you wake up in the morning, just to kind of get the spine articulating, hips open and moving, and get some good blood flow going. The first exercise, you're going to sit down on the floor, just a nice sturdy ground. You're going to have your legs out in front of you. This is called a roll-up. Your spine's going to be tall and lifted. Long legs. If you tend to have really tight hamstrings, you can bend them a little bit. Okay, don't force it down, sitting as tall as you can. Closing the ribs, pulling your belly button to your spine. Arms come straight out in front of you with your shoulder blades back and down. Take a big breath in through the nose, and then exhale through the mouth as you roll down, articulating your spine down one vertebrae at a time. Get a big stretch at the bottom. I say, as long as there's no pain, open up the ribs here. Okay, big inhale. That could be a pretty controversial comment in the Pilates world, but I think it feels good. And then exhale, close the rib cage, lock those shoulder blades back and down, bring the chin to your chest, flatten the abs, really try to flatten, pulling them in, closing those ribs, articulating my spine, rolling it up one vertebrae at a time. I'm going to stretch it all the way forward as far as it's comfortable, pulling my abs still in, and then roll up nice and tall and reset, and do it again, rolling all the way down, stretching it out, and then you can repeat that about 6 times. Okay. Your next exercise that you're going to do is called a pelvic lift, also known as a bridge, but in Pilates we want to have a little bit more spinal articulation. So you want to start with a neutral pelvis, having a natural arch in your low back, just a tiny bit, like if a pencil could slide through it, and your rib cage closed. From here, your heels are just slightly forward from your knees, nice and aligned, shoulder blades back and down, long necked. You can also squeeze a pillow in between here if you had one. Big inhale through the nose. Exhale, you're going to imprint, so gently flattening your low back, rolling your spine up one vertebrae at a time. Hold it here. This allows you to open up the hip flexors, get the glutes turned on a little bit. My abs are pulled in, my ribs are closed. Stretching my arms long. Inhale here again, and exhale, closing those rib cage, rolling down, really articulating the spine one vertebrae at a time. I have to keep tucking my hips, rolling all the way to an imprint and all the way back to a neutral spine. I'll show you without speaking. Inhaling and exhale.
Keep this heavy and push out. Don't let yourself go. Yes, there you go. That's it.
Okay, so do about 6 of those too. And then the next exercise, you're going to bring your legs into what we call a tabletop. So you're going to have your heels and your knees in the same line. Heels can be slightly above, but don't bring them below. Squeeze your knees tightly together, or you can also have a pillow in between them to stabilize. Right here, we want a neutral spine if it doesn't cause pain, having a small little arch in your low back, as long as those ribs are down and closed to correct it. Shoulder blades are actually going to be flat, arms out to your sides, palms up. And then you're gently just going to rock your legs back and forth. Notice that my ribs are staying closed. I'm only going as far as I can control the movement without my opposite shoulder lifting. You don't want to allow it to roll. You don't want to allow your knees to drop or to twist your back, okay? Just kind of loosening up the low back, getting some blood going, getting it moving, okay? I do 6 to 10 of those, okay? Then you're going to bring one leg down and then the other. Keep the arms the same. For the next exercise, you're going to cross your ankle over a knee, and then you're going to go to that same side as far as you can, keeping the opposite shoulder down as far as you can without pain, and then bringing it back to the center. Stay on that side only for 6 to 10. This feels actually really good. You get a good stretch through the glutes, through the IT band, even in the obliques and the low back. Again, none of this should be painful. Should hurt so good, not so bad. And then you're going to switch and do the other side. Opening up the hips.
Now I want you to imagine you're zipping up the back of the neck.
Okay, for 6 to 10 exercises or repetitions. You're going to bring your knees and your feet all the way together. This is an exercise that is not good for everybody, so just know if you have knee pain or if it, again, hurts so bad in your low back, your knee, or your hip, stop immediately. But for some people who have a little bit more flexibility, it can be really good. So you bring your knees together, walk your feet apart as wide as you're comfortable with. Okay, you should feel kind of a pull, a stretching here. Okay, again with no pain. If that's feeling good, just kind of set it for a second, and then you're going to lift one knee, just kind of bring it up and press the other one gently down. This is helping to open up my hip flexor. I get a stretch through here. I actually, because I'm tight in the side, even feel it all the way up to my psoas. So muscle all the way through here that needs to be stretched. And then I'm just going to go back and forth, just gently, just to where it feels good. I'm going to go 6 to 10 reps. Again, no knee pain, no back pain. Okay, after I do 6 to 10 reps, I'm going to bring my legs back in. Last exercise, open up the hips the opposite direction. I'm going to bring my feet together and open my legs. And then I can just lay here. You don't really have to overthink your ribs being closed. Okay, if this causes any low back pain, you're going to want to push the rib cage down a little bit, hold the abs in. But if not, just relax here. Okay? When you're done, go ahead and sit up. And your back should be feeling a little bit better. Sometimes it's a really big difference just from those few exercises a day. So hopefully that helped. Thanks.